So now I'm presenting Elena Martinez, who directs another driving biological project, and this is a joint project with Maricopa Health System in Arizona.
Okay, I'm not
So
a Mac user either.
yeah, I'll just click the magic button for you.
Which is the, I should learn this.
Just,
Okay, got it.
and there you go.
Okay, thank you very much and good afternoon to everyone. Thanks for having me. Very happy to be here. And now I know another one of Lucila's skills of coming up with acronyms. I didn't know that about you, but very good. Okay, so in this afternoon's presentation, I'm going to go over the progress mainly of our driving biological project. Focus a little bit, go pretty quickly through the background and rationale for this project, the goals and specific aims, review of the methods, and then focus on the progress report and future directions. We are just entering our second year. All right, so this has to do with obtaining informed consent for collection or sharing of data in biological samples. We know this is extremely complex, but because we are focusing on an underserved population in Maricopa County, this is even more challenging. And there is a perception that individuals, and I call it a perception, that individuals from underserved populations or certain racial ethnic groups are less likely to share their biospecimens than other groups, and I would like to challenge that perception, at least for some of the groups. The published reports in the literature, there actually aren't that many reports in this area as it pertains to underserved populations. There are data focusing on knowledge and understanding about specimen sharing, a lot of formative research and work in this area, and the use of existing or stored biological specimens. And there are more data more recently on the individuals' willingness to provide. So asking individuals, are you willing to provide a sample? But less data on actual provision of these. So perhaps asking whether you're willing to provide is not equal to actually providing those samples. We have less data on the latter. Okay, so just a couple of recent publications. I think I shared this one last year, but it is an important one because there are so few data in Latino populations, which is the primary population in our study. This study was conducted by the Lombardi Cancer Center group, Chris Lofredo, a colleague of mine. Again, these investigators looked at factors associated with knowledge and intention to provide biospecimens. The sample is actually, for this type of study, is actually pretty large, and it's 331 foreign-born Latinos from Central and South America who live in the DC area. And these are the results, again, very descriptive study. 47% knew what biospecimens were, and 67% said they would be willing to provide a specimen if given the information about this, about what this involved. There was a suggestion that individuals from higher educational levels were more willing to provide than those from lower education levels. But interesting, and I want to get back to this, in this population of Latinos, medical mistrust was not related to provision, and this is something that we're going to be able to hopefully test in our study. This is a paper that was published after I presented last year, and this, again, formative research from the Lombardi group as well. They conducted some focus groups involving key informative interviewers or interviewees, as well as some members of the Latino community, stakeholders. And they just provide some general guidelines for moving forward with this type of research. Again, very, very descriptive, but important because it's focusing solely on the Latino community. So the rationale for our study is that the need for biospecimen repositories, there is a need to include samples from individuals from traditionally underrepresented groups, such as the Latino and other underserved populations. And there are, as Dr. Talavera noted, perceived barriers related to biospecimen donation, including the lack of information or knowledge, fear, and mistrust, among others. Our DBP was conducted in Maricopa County, and it's a pilot study to compare physician versus non-physician delivery of informed consent for biospecimen and data sharing among underserved women in a safety net care setting. And this is being done by Dr. Comaneca, Ian Comaneca at Maricopa County Hospital. I show you his picture because look at him. He is extremely charismatic. His patients absolutely adore him. How can you say no to this guy, right? And he loves his patients. He takes very good care of his patients. So he gets very high participation rates. He participated in another study of ours, not an intervention study, but nevertheless it involved questionnaire administration as well as biospecimen donation for our study. And I think he missed one patient. Only one patient said no. So we know that there is something here about the Ian effect. So we wanted to test the Ian effect against something else. That's what, actually, Lucilla, you came up with that, the Ian effect. So here are the specific aims of our DBP. We want to compare informed consent for biospecimen collection and data sharing for research obtained by a physician, and it's only Ian who's obtaining this because we wanted to test the Ian effect, versus consent obtained by a research assistant. Both of these are being done electronically via an iPad. We have an exploratory aim to look at differences of the informed consent delivery by various factors included here, but very exploratory because our sample is not large. Again, the patient population is in Maricopa Integrated Health Services, which serves a racially and ethnically diverse population, many whom face major challenges to accessing health care. And this is being done in the breast center of this hospital, which serves about 900 patients per year, and it diagnoses 9 to 10 new breast cancers per month. And just a little bit more about the MIHS. It's a healthcare safety net provider for residents of Maricopa County, a very large region. Here is the distribution by socioeconomic status. As you can see, a high proportion of women. There are a few men who have less than high school education. 90% are uninsured or on Medicaid, and 3.5% on Medicare. Here's the race ethnicity breakdown. The largest proportion, the largest group is the Hispanic Latino community, and more than 50%, or approximately 50%, are non-English speakers. So you can get a sense of the population we're dealing with. So we plan to recruit 140 women, 70 to each arm. Here are the eligibility criteria. These are for any woman undergoing a biopsy for any reason. When we planned this study, we planned to put together a video, a short educational video about the benefits of biospecimen sharing for this research. We actually found the video. Christy Wells, who's sitting in the audience and will be participating in the next session, had one that she and her colleagues developed at the Moffitt Cancer Center. And we considered using this video. However, the video has not been tested. The efficacy of the video has not been tested, so we didn't want to introduce this when we didn't know about the effects of the video. So we considered having it later, but I will tell you what we're thinking now based on what we saw a couple of weeks ago when we were visiting Ian. Here are the outcomes measures, participation rate by randomization arm, and as I said, we have a series of exploratory steps that we would like to conduct in our analysis. And the tissue that we are collecting is a saliva sample, but we're also asking the women to allow us to have some of their tumor tissue that Ian and the physicians take, extra tissue that's left over from the pathology lab. Christy and Jesse Nodora and I visited Ian a couple of weeks ago, so this is a picture when we were visiting them. This is Marcia Button, who is his physician's assistant. So the data that are being collected include sociodemographics. There's the cancer risk perception questionnaire. Ian has been administering or assessing health literacy in his all his patients for the last 2 to 3 years. Christy Wells allowed us to use her trust survey, so that is being administered, and Ian administers a satisfaction survey on his own to all his patients. So some of this is already implemented in Ian's clinic as part of the routine. So here is where we are. Let's start with the accomplishments. So electronic consent was achieved and it's up and running. IRB approval was not trivial, but we accomplished that, or Ian accomplished that in Maricopa. The staff training, the IT support, thank you, I-. Collection and transfer of saliva samples has already started. Few refusals, so recruitment is fast. So you already get a sense that there are fewer refusals in this population in either arm. Challenges and hurdles. It took a little while for Ian to get his funds, so the study started going, or the activity started going a little bit later than planned. For some reason, again, this is a county hospital, ordering the saliva kits took forever, and he couldn't even figure out why they would not order the saliva kits, so he couldn't get the study started until these were in place. The hiring of a research assistant, because this is, I think, a 30% person. It has to be shared with somebody, so it has to be approved by the research department. They had to find somebody. Thankfully, there are very good bilingual, bicultural research assistants available, but it took a little while. Permission to purchase an iPad. Ian was forced to use this clumpy, I don't even know what brand, he told us when we were there, that took 45 minutes to administer the consent. 45 minutes with this clunky dinosaur, I guess. Finally, he convinced them, it's an iPad that I need. It's an iPad. It went from 45 minutes to, I don't know, 8 minutes or something like that. So everything is running smoothly now. It's slow accrual because it got started late and because of some hurdles. I want to later on come back to this, and this is acquiring of tumor tissue. I mentioned this to Lucilla when we were there, because Maricopa is now rethinking whether they want to have any tumor biorepositories, and I think this is something that other hospitals are rethinking. So they're not even sure that they want to be part of this process for this study, even though the patients say, you can have my tissue. And so that's an issue that I would like to come back to. Okay? So here are the accruals, again, because of various barriers. The goal was to have 2 to 3 per week for 15 months to reach our goal of 140 by the end of December 2015. The recruitment began, or the study began in June 19th. Recruiting 2 to 3 per week, even though Ian is only doing this study once per week because he's a busy surgeon. The rest of the week he is mostly really busy with patient care and surgery. As of September 4th, 22 participants have been randomized, so we need to recruit 118 patients, or about 8 per month. So how are we going to do this? Well, when we were there visiting a couple of weeks ago, as I said, actually the day we were there to observe the process of consenting, the research assistant was sick. And we didn't know she was going to be sick, obviously. So we show up, the 3 of us from the team, and there were no patients to consent because it was the way the randomization worked. It was her turn to do the randomization, and it wasn't Ian's. So we didn't get to observe any consenting process, so we're going to do a second visit. But it was still worthwhile because we learned about some of the hurdles, the iPad, and we also learned that of the single research assistant available for the study. So Ian and Marcia brought up one of the head of the research department, and she was convinced that there needed to be another research assistant available. So they are actually they just hired the second one, and they're going to have a recruitment 2 days a week instead of 1 day a week. So, but there is no shortage of patients at all. And given the already high consent rate and that we don't plan to use the video, because it's already a high consent rate, why do you introduce a video and just introduce another unneeded, unnecessary step? So we don't think there will be an issue with meeting the recruitment goals. Continue to send saliva samples to UCSD, but we are uncertain right now as to whether we will receive any tumor samples. Again, Marcia and Ian do not know what's going on with their hospital. Their hospital lawyers and IRB and pathology department is not sharing a lot of information with them as to what they plan to do, whether they will participate in the tumor sample collection or retrieval of this study, even though the patients consented to this. And I don't have the answer, so I'm hoping that somebody here can help us with that. I want to show you the timeline just so you know that we will be on track now that there are 2 research assistants hired and trained. This is where the study started. This is where we are or plan to be very soon, because we're going to pick it up, and by December we are estimating that we'll have 100, and by April 2015 140. So we'll be fine now that there are 2 research assistants. Just want to end with a couple of unsolicited participant comments that Ian has started collecting or keeping track of because they're unsolicited. 40-year-old female being seen for follow-up. After giving her sputum sample, she said, "Even though I will not benefit from this research, it makes me feel good that I will be helping other people." This is another one that Ian feels terrible about. He still talks about it. This 59-year-old female with a recurrent breast cancer, and Ian consented her for Myria testing. She consented her for the City of Hope Registry, which she participates in. And then he consented her for this study. And after she did all of that, Ian dropped the sputum sample on the floor after she had to. And he felt terrible. He said, no, just come back another time. We'll do it next time. She said, no, I'll do this now. This is not a problem. This is important. And he noted that she had 2 of her adopted kids with her, and they also were very supportive of the research. This is the environment that he lives in. So this is a very different environment that I want to point out. Okay, so I just want to end by thanking Ian and Marcia and the others at Maricopa and the group from here at UCSD, including the I-DASH team. Thank you very much.
Thank you. Any questions? I have one of my own.
Yes.
For the ethics people in the audience. Also, we have those samples now, or we'll have soon, and they're in Olivia's freezer.
Mm-hmm.
Is it unethical not to use them for some research? Because we have collected them. And
That is a
spent
very
money
good question.
with that, and people are expecting some good out of them. So that's one of the questions. The other one is we need the picture of the research assistant.
You need the picture of the research assistant.
Oh, yeah.
There's 2 of them, so I'll have to get them.
You bring
I'll
it,
get
and
bo-
then we can assess if the...
No, we were very careful. So Christy is here because he said if you hire another one, she has to look the same. It has to be a woman, and she has to be the same age. She has to look the same. I mean, you can't introduce a new one. We were very, very concerned, right, Christy? And he said she's fine. Does she have a sister? Does she have a twin? Yeah. But we will get those pictures. We'll be back for a few more visits.
Great. Well, thank you, Elena.
Thank you.